Good morning, everybody, and welcome to Health Talk. I am your host, Dr. Neeru Prasad, with my background in pediatrics, emergency medicine, and urgent care, affiliated with the St. Joe Hospital, Beaumont, and Henry Ford. The theme of my health talk today is mental health disorders among our children, adolescents, and adults. And as we know, in spite of all the researches have been done as to how to take care of these people with the mental disorders, the new drugs, the new scientific research, still, in spite of everything, this has become like a global pattern all over the world. And they are present in different stages in different countries. And the recent statistics, as reported by World Health Organization, says that this is the number one cause in acute anxiety syndrome, depression, and the suicidal gesture, suicide. So these are just the beginning, and I prepared some slides, and I will share those slides with you. So next slide, please. So first of all, just as an introductory remarks, what are the conditions that are good for a normal upbringing of child, adolescent, and the adults? Most important thing is a very stable home environment. Nutrition, sleep, and exercise, they play an important role in a healthy growing of the children. Social media and peer influence, like as you know, there is so much of social media platforms. Some of them are good, some of them are harmful and toxic. And then it's more prevalent among high risk groups. The high risk groups include the minorities, those with a chronic illness, autism, and more. Next slide, please. So here I have a picture of a gentleman who is showing an acute anxiety episodes. Genetic predisposition. They say that genes play a significant role, for the acute anxiety attacks, depressions. Environment stress is very important if somebody is coming from an unhealthy health situation, family trauma and conflict, history of alcohol drinking at the home, and a poor attachment and supervision. Like there's a lack of supervisions of these people. Substance abuse has become very, very common, and the substance abuse, it leads to due to the tobacco, alcohol, and the cannabis. Next slide, please. Here is a picture of a child. I mean, not really a small child, but sometime older, who is showing a temper tantrum, acute anxiety, depression, social isolation, like the kids are left alone at home, and that is not a good environment for them to grow. And eating disorders, they play a significant role in the depression. Thus, eating disorders that include loss of appetite, bulimia. So all these factors, they play an important role in the next slide, please. Attention deficit disorder. The chronic behavioral disorder, I have classified it according to the age sequence. Attention deficit disorder. This starts very early during the childhood growth development. Maybe even when the kids are ready to go to the kindergarten, and it persists. Attention deficit disorders can be in different manifestation. Conduct disorders like abruptive behavior, like even among the school crowds, they can have a conduct disorder like anger. And substance abuse, like I said before, is very important. Psychosis. Today I'm going to concentrate more about the psychotic disorder, which are becoming so prevalent. Next slide, please. The psychotic disorders include, this is a loss of, what is a psychosis? Psychosis include when somebody has a loss of contact with the reality, and that includes schizophrenia. Schizophrenia like disorder that is called schizoaffective disorder, delusional disorder, very, very common, a brief psychotic episode, like victims of psychotic disorder, they can have a brief episodes of psychotic episode, then they are normal. During the psychotic episode, they can hallucinate. So now this kind of disorders, they come usually in late adolescence and early adulthood. And the symptoms include delusions, hallucinations, disorganized thoughts, and erratic behavior. Now, what are the causes of this? The main cause of all this is that there is a defective neurotransmitter system, like the dopamine, and I will come back again on the dopamine and the serotonin, how they affect the mood disorders. Next slide, please. So what do they do? They have a loss of contact with the reality. This people, hallucinations, like I said before, delusions of what they could have been, disorganized thinking. The thinkings are very much impaired. And these are mostly the symptoms of schizophrenia, psychoaffective disorders. Next slide, please. So now before I go further into the psychotic episodes, I just want you to know that it is us, a pediatrician, sitting in their office, the primary care physician. This is the responsibility of them to get a complete history, evaluation, check before they refer to the mental health. As I'm sitting in my office and I see a juvenile walks in, first thing I notice is the eye sign, which is very important. No eye contact, and that wonders me, that brings a thought, why somebody does not have an eye contact. By looking closely at their eyes, I find out that they have a little nystagmus, impaired vision, impaired visual field, loss of hearing. So these are the ones that should be evaluated at the primary care physicians. And then before anybody is sent to the mental health, they should be evaluated by the nurse and the social service, social worker, and the therapist. You cannot just jump on sending anybody to the psychiatrist first. They should be evaluated by the mental health nurse and their social workers, furthermore. Next slide, please. So how do you treat all these things? Psychotherapy and medications, they play a very important role in this. Psychotherapy, the meditation has a big role in suppressing some of the symptoms of anxiety, depressions. Psychotherapy, family counseling, it's not just the patient. The family counseling is very important. They are the one, because they are the one, who are following him. Family calling. And then, in severe cases, of course, hospitalization to a behavioral institution. So this is not one thing. This is a multidisciplinary team care which is responsible to take care of the mental disorder adaptive behaviors. Next slide, please. So here is a person who seems like he's very much depressed, lonely, and basically here he needs a lot of therapy. There are a lot of medications besides the meditation area, psychedelics, and psychedelics are there to improve the symptoms and cure some of the symptoms. I did a good review of the scientific researches that have been going on about the psychedelics, and I have included those in the bibliography. The World Health Organization, the American Academy of Pediatrics, they have all done a lot of their members of the Academy of Pediatrics in the psychiatric group. They all have done a lot of researches about the psychedelics. Like there are some psychedelics that are after research from the Johns Hopkins University group. The bottom line, the conclusion that is derived, that the psychedelics, they can help with the negative symptoms such as apathy, social withdrawal. Still, they are experimental due to the fact that some of the psychedelics might have an abnormal symptoms. It might even aggravate the symptoms. So the scientists have emphasized the importance of setting S, supervision, the 3S, setting and supervision, referring to the mental state, physical environment, and professional oversight during the psychedelic use. Next slide, please. So here is, like I mentioned before, Johns Hopkins group on the psilocybin and schizophrenia. Some benefits are there, but there is a risk factor. It might aggravate because these individuals, they already have an abnormal neuron pathway to the cerebral cortex, and when you give the psychedelics, it can cause the negative effect. So now the future research is going to be about the non-hallucinogenic derivatives. So now the mental health disorders among the youth and the adult, they are complex and multifactorial. And overall, just to summarize all this, it involves genetic, environment, and social condition. So the treatment should be all personalized, and the new drugs of psychedelics, which I haven't gone into the detail because I put them on the bibliography, and the psychedelic drugs, they are usually prescribed by the psychiatrist. So I didn't want to go into details of this. There are a couple of drugs which are under investigation, and they must be applied with the scientific rigor and the caution, in especially in the vulnerable conditions like people with the schizophrenia. Parents, caregivers, teachers, the healthcare professional all have the vital roles in promoting early intervention, building the resilience, and creating a supportive environment for the mental well-being. From my experience working with all these kids in the pediatrics, seeing them when they are sick at the urgent care, seeing them with the abruptive behaviors like a temper tantrum and more, bulimia, self-destruction, these incidents that I have seen working all these years. I prepared this podcast to share with you guys out from my own clinical experience. I strongly recommend and advise the listeners of my speech to get a thorough checkup by their pediatrician, by their family practitioner, by the social service, the behavioral therapist, and the psychiatrist. And I have given so these are the references that I put. There are much more references besides this. And the most important one now recently has come from the National Institute of Mental Health. And also a very good articles came by the Lancet Psychiatry and the JAMA Psychiatry. So, next slide, please. Okay. So now I just mentioned just a one slide footnote about the psilocybin. Like us, the psilocybin have a therapeutic potential to manage. Researchers have proved the fact psilocybin, LSD, and another new drugs are experimental. Ayahuasca, they have re-emerged in psychiatric research, showing a good result with treatment of acute depression, post-traumatic trauma syndrome, and acute anxiety attacks. However, these drugs, like I mentioned before, their use in schizophrenia is still controversy. A lot of the psychiatrists, they have been using like a low dose of this to treat the acute anxiety attacks. But the bottom line is because of the psilocybin have a therapeutic potential in managing the negative symptoms, social withdrawal, flat emotion in schizophrenia. A low dose have been tried using. Microdosing psychedelic is another chapter that I went through that, but it was too much for me to include it in my slide presentation. This is being tried to avoid like a full-blown episode. Researchers are being like I said before, about use of non-hallucinogenic derivatives of psychedelics, that might in future be of helpful. So bottom line is again a good home environment, if a good clinical assessment to see, and evaluation by a psychiatrist, evaluation by a good psychiatrist before any treatment are discharged. So in fact, in summary, I talked about common behavioral disorder, attention deficit, conduct disorder, psychosis, and substance abuse disorder. The substance abuse disorder, like use of tobacco, alcohol, cannabis as a disruptive mental behavior, is another big chapter. And in future, I will be talking more in detail about this. So now I like to thank our viewers for watching me on my listening to my podcast. And in future, I will go more in details about the substance abuse, tobacco, alcohol, and cannabis, which is becoming more and more common among these. And like I said before, these are my own views from my clinical experience, and I advise each and every listener to have a thorough evaluation by their primary care physician, by their therapist, their mental health specialist, and the psychiatrist. I like to thank our listeners for listening to my podcast about the mental health disorders among childhood, adolescent, and adults. I like to thank our producer for helping me produce this video. And until I see you again, have a very safe, wonderful summer. Thank you again.